asked to move to another side of the hall, so I hope here is good enough. Yes, I think the anchor has done a good one reminding us of the background, and I think we are all very excited to have with us Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, who I'm sure will give us further insight into what we saw just a few moments back. And for me to grill him, it's such that it's like grilling my own. But for one who believes in inclusiveness and is going to speak truth to power, please welcome with me the Coordinating Minister of Health and Social Welfare. Thank you. You're welcome. Before you came in, we were having a dialogue. Yeah, for the minister. Okay. Before you came in, Honorable Minister, we were speaking to facts. We were speaking to what the subnationals are able to do, falling in line with the reforms of your administration. I think we need a background. Tell us what's your reform is all about, especially seeing that documentary. 7 minutes, so compelling, yet so realistic, even in Bauchi State, if I may say that.
Well, thank you. Thank you, Auntie Moji and Premium Times and all the organizers. This is a very serious issue. This is life and death. And so, as you've gathered a full house of excellencies, deputy governors, commissioners, other leaders, I wonder how much time do we have to delve into this issue. We should take as much time as we need to discuss it if we really want to give the seriousness of this issue the attention that it deserves. So I hope you'll bear with me if we really truly make it a deep conversation. I don't have any remarks. I will tell it as it is because I've been here 2.5 years. And I think we can all come to some understanding, I hope better understanding. And the video that was curated, it's truly very touching because this is lives, this is the state of the country. But why is it? Health, as the moderator, or you're not the moderator, but someone said, is a choice. Essentially, it's a political choice. It's a choice for any country, any people, not only one government, not only the public or the private sector. Citizens themselves choose whether to build their health system or not to build their health system. For a very long time, Afrobarometer had surveyed African countries and asked people, what do you care the most? In most countries, health is number one, except one country, which I will not mention, where health is number two. So this has been for decades in the making, that the prioritization by citizens on investment in health is key. And if you look at the trends over 30 years, how much have we been allocating resources to health across different levels of government, across local governments, state governments, and federal government? Not much. Less than $7, $8 per person, federal, and if you add all the states, another $7, $8 per person. Much of the spending was coming from households out of pocket. That's the structure of the Nigerian health system, how it's financed. Now with $15 per person, what will you buy with it per person, per year? This is what we allocated through budget. If budgets are the indication of priorities of a society, we spend a lot more on Facebook and data and phones and all of that. But on health, for decades, we had not invested. And those priorities, where our legislature, whether appropriators, whether the executive, we have not invested in the infrastructure. So when you see the infrastructure that is dilapidated, or the schools that are unbuilt, or the remuneration that is, or the equipment that is not there, is because the resources had not been provided over time, over decades, and they atrophied. And yet, we've been spending other things. I'm sure we've partied more than $14 per person as a country over the last year or so. But the political consensus to invest in health had been shot. And that resulted in what we're seeing. The system that we run produced the results that we are seeing, and we're complaining. So the what is clear. We had a whole system that is relatively underperformed. And the choices that we had made over decades meant that it didn't have the resources that it needed. And overall, our government revenue relative to our GDP, I'm saying this because you are journalists, you can check this out, was among the lowest in the world until 2023, at 7.5% of revenue to GDP. It was among the lowest. Why? Because we did not consider it serious enough to ensure the revenues accruing to government, the taxes that are accruing to government, the exemptions that ought to be limited. So we just took a pass. There wasn't the discipline to collect the revenue. Now, if you don't collect the revenue, the pool of revenue that government has itself is limited, of which it allocates even more limited to health, to education, to other things. So the connection of the revenues available to government and the spending, the elite, we collectively seceded from Nigeria because the commons, we didn't attend to it. Everyone was taking care of him or herself and his close families, and we didn't look at the commons. And you reflect that in our Gini coefficient. We're a very unequal country. In 2012, when I was back here as Minister of State, we did analysis of the demographic and health survey data across several countries in Africa who are comparable to us, not China, not other wealthier countries. And we compared the poorest income quintiles and the wealthiest 20% in terms of access and utilization of services. This is more than 10 years ago. And we saw a graph that was like a broomstick. The wealthiest 20th percentile of our population had better access to health services and utilized more of those health services than the poorest of our population. But the poorest in Nigeria were among the least compared to the comparator states. So in every country there's inequality. But the degree of inequality that we saw was far higher in Nigeria, because in Nigeria, we the elites, you care about yourself, but you are okay for the poor and others, their lives don't matter. And equity was not explicit in our policy space. And this is analysis that we did, and I think for the journalists who want to see this, they can do it again, or they can come to my office and we can provide it. I'm giving you these facts so that you understand where we're coming from. 2004 was when we tried to fix the constitutional lacuna, where the fiscal federalism allocated health not on the exclusively of federal government, so it's a responsibility of federal government, states, and local governments. But then it's nobody's responsibility. So 2004, God bless Professor Lambo, my predecessor, and the health reform in 2004, ascribed primary health care as responsibilities of local government by policy. States, secondary care, and supporting local governments on primary health care. That is a decentralized model. And federal government, research, public health, and tertiary hospitals. But the outcomes didn't improve. So to fix it, the health reform started the process for the Health Act, which took 10 years because of how much we prioritized it. 10 years to pass the Health Act in 2014, which created the Health Act, the Basic Healthcare Provision Fund that we're not talking about. It took 10 years to pass that law. How many laws have we passed? That was passed, signed into law, but its execution didn't pick up. For the 10 years since that law was passed, the funds were only provided 4 or 5 times. In the last 2 years, every quarter we've had an MOC. We've done 2/3 of all the MOCs done in the last 10, 11 years in just these last 2 years, because we focused on implementing the law. that was passed that tries to bring primary health care to life. Even if it is not directly federal responsibility, but federal government, we cannot stand by in Abuja and allow this picture that you are seeing to continue. That's why we intervene. You may call it an overreach, but what is the business of federal government in building PHC in every community? When there are local government, there are states. But knowing the fiscal circumstances of those states, of course, federal government had to intervene. But I want to connect it, Madam Moji, to the macro fiscal reforms. Since 2023 till today, and you can check this out, the revenue to GDP has increased. It's now about 13% or more. I think you can check that out. There is more revenue, even though nominally, because of the valuation, it's not gone up, but at least so the truth of the matter is that now we have additional revenues. So how do we ensure that these additional revenues, as they come through, we invest and all levels invest so that the picture that you have seen here will no longer be the norm? How are we asking respective states, local governments to do their own part? So when you ask me the question of what is the reform that we've been trying to do over the last 2 years, understanding the history of what we have been is why we said, and the President launched the Health Sector Renewal Investment Initiative in December 2023, that says we'll focus on 4 things. There are enough problems, but how do we focus on 4 things? First, the governance of it, because that's not technical. You have to organize better. And that's why we signed the compact with the states, with all the state governors. Ultimately, we brought in ALGON. We brought in our development partners. In the past, everybody was doing their own thing. Nigeria is not bereft of capacity. There are lots of individual capacity, but they are all working at cross purposes. This state doing this state doing that. But to bring that together and have a compact, why did it take this long to have a compact that says this is ask, this is offer? To put structures for transparency, for accountability, for quarterly performance dialogues, to have joint reviews. We just finished our joint review. So we assess our performance to respond to citizens' needs. We had 3 now People's Voices survey, 2023, 2024, and 2025, to be responding so that it's not just top-down, but we also listen to what the citizens are saying. How do we then increase domestic resources as the reforms are taking place? That's why federal government increased. It was 1 point something trillion. Now it's almost 2.7 trillion to health. Doubled the BHCPF from the federal government, expecting the states will also do that. Because if you don't have the organization, you can increase the budget, spend it, but spend it on the not efficient things. Allocate it very inefficiently. So you spend on just the buildings and stuff, but not on what matters. So what we've been trying to do is to allocate better, allocate more efficiently, allocate more to the primary healthcare system. But the primary healthcare system cannot stand on its own. That's why it needs the hospitals as well. And so double down on the hospitals, on the cancer, on the ICU, on the imaging, and then deal with the affordability, the second pillar of agenda as well, the affordability so that health insurance becomes available. And knowing fully well, and you talk about mothers dying, more than 20, 30 years ago, Kelsey Harrison, a professor at Zaria, did a study, and this study is public information. Folks here may remember. He studied 20,000 maternal deaths in northern Nigeria. And if I remember correctly, half the deaths were not attributable to things that linked directly to the health system. There were other determinants: education, empowerment, access to transportation, early services, power, and the health part. So as we launch things like MAMI to crash maternal mortality, we're beginning to see at least some reduction in maternal mortality, but that's too small, too early. But at least it's a start. And building our hospitals, expanding insurance, and to produce. Why has it taken us this while to start even producing devices? 99% of our devices, we import them. Why? 75% of generic products, 100% of our branded, we import them. Why? We were not serious enough as a people, private sector, public sector, and the environment, the policy environment, the regulatory environment didn't help. But we're trying to change that. It will take time for it to happen. But if we are determined, we can do it. And then public health, the security and all of that. All in all, to say that what has taken decades to atrophy, it will take time to fix. And lamenting on the what, these are all known. But the how is less. How do you fix it if there are 1,000 problems? What we've done under this president is to say, let's begin to fix it in a determined way and not be distracted. And let's begin to show results and help that others, whether media, whether states, whether local government, whether partners, instead of complaining, let's join hands. Let states also key into what the president is trying to do so that we get the health system that we deserve, because at the end of the day, it is all of us that will create it. So a very long-winded answer, Timothy.
Yes, I needed to allow him to give us that background, particularly that I have my colleagues in the room, for us to see, to justify what Idris, you missed that submission, the editor-in-chief at the Premier Times, he made a submission that spoke and alluded to the fact that we do have a problem, but I call them challenges. The gaps the minister has been bold enough to speak to. How do we fix the gaps? I think one thing that has happened, which I am privileged to be a part of, is the inclusiveness of governance in the Federal Ministry of Health. And I think the minister deserves a loud round of applause for that. Hearing people's voices. But beyond that, Honorable Coordinating Minister of Health and Social Welfare, how fast must we go? I'm a student of accentuating the positive. How do we stimulate people, for people to know that when you're talking to health, it's not just about Federal Ministry of Health or the State Ministry of Health. It's about collective responsibility going further. Before you came in, we had a submission on public-private mix. So, Honorable Minister, give us a priority in terms of using this platform to stimulate growth, quality growth in healthcare delivery. Yes?
Okay. So how fast can we go? I think as fast as we can go. For the women and children that are dying, it's too late already. For them, it's already too late. We have to double down, and we have to go as fast as we can. And that means all of us. But as we do that, we have to also be mindful of the narrative that we are creating and what we want to project. So there's one narrative which is self-defeating, and you can bring that is mostly about the problems. But without ignoring the problems, there's also an alternate narrative to say what are the good things that we are doing and that we can do. And it is not perfect, but at least that provides a basis for enforcement, for building consensus to continue to do the good things. When Nigeria was blamed for polio eradication, there was a World Health Assembly resolution that condemned Nigeria specifically. There was paralysis, everybody was lamenting. But within 2 years, this country, across levels, with traditional institutions, built another consensus what was different. And this country moved and was able to eliminate wild polio virus. So if we build that, it's a psychological state of mind. There's one who says, okay, nothing works, it's hopeless, let's all go home and let's fight ourselves. This is a problem, and keep repeating the problems. It will never solve the problems. And there are others who will enjoy us talking about the problems because they will thrive on our problems. But there's another angle that says we know that we have problems and we're not hiding from those problems. How do we contribute to solve this problem? So the private sector, I saw Dr. Wada. 2 days ago, he launched the first robotic surgical platform in this part of the world. I think he needs a round of applause. At NISA Premier, in collaboration with diasporans, Nigerian diaspora that came to Abuja, came to a hospital, used a robotic platform, did successful surgeries that is world-class, and is training folks. And in his hospital, I saw other Africans coming to the hospital, one from Angola, I believe, from 4 countries, coming to be trained here in Nigeria. There are professionals coming from UK, setting up private practice, Marcel Ruth in Lagos. There's Professor Julius Oni, a professor of orthopedics at Johns Hopkins University. He's done 50 knee replacement surgeries in Lagos in just a few months of his facility. So there are some things that are beginning to happen. We've seen increase in utilization of primary health care, less than 10 million to more than 40 million in the second quarter of 2025. We've seen in the Mami local government, even the maternal mortality, 17% reduction with good data, and you journalists can go and check that. And 10% or 12% in neonatal mortality. It's not solving. It's only in 172 local government that accounted for more than half. So at least we're beginning to tackle real issues, not just conceptual issues or lamentation, but really trying to fix it. So the question is, each and every one of us, what can you do? So, Antimoji, everywhere there is health conversation, you are enlightening Nigerians, you're enlightening policymakers. Her Excellency is up and down on primary health care, and I think she and Kaduna State, they are trying to work it out because it's adaptive. There's no health system that doesn't have challenges, but their leaders are paying attention. The commissioners were with me 2 weeks ago in the JAR. They will spend 3 days, morning till night, at the National Council on Health. And his governor, in fact, a week ago, he was in the office from 3 p.m. till 1 a.m., the governor of Jigawa State, doing health sector review. I woke up in the morning and I saw the picture. So if every public leader will step up and pay attention to what they are doing, and the private sector looks at, this is my business, what do I need? Where there are wrinkles, there are challenges, how can government support? Bootstrap. The civil society orient themselves instead of lamenting or just advocating on the same issues. Go and ask the states and local government, what are we happening? How's our budget? Not to judge, but to say, how can we help? Not to complain only, but to say, here's the solution. Here's what we think can be done better. And we began to see that with our health fellows, for instance, national health fellows across the 700s of rural local government. My goodness, those young people, they are not health experts, but they came with amazing energy. And so all of us can do something for us to go fast enough to unlock the private sector potential that exists, but also ensure the public interest and the public services are delivered. So together, then we revamp this health system over time.
Together, I like that. There are concerns also about budget in terms of capital release. How does this impact with implementation?
A lot, not only in federal government, but states, local governments. We have the practice of allocation, and then the releases could lag behind. At least for the federal government side, I will have to acknowledge the Minister of Finance, for instance. We went to him just 2 weeks ago and said, okay, we need a co-financing. There and then, and if there are development partners, I think Gates supported this. I don't know whether there was somebody from Gates with us when we went to see him. The meeting was the shortest meeting I've ever had. It lasted 2 minutes. He approved 68 billion naira. That was a Friday. On Tuesday, I was in Calabar. EDMPH said the money is in his account. By Wednesday, Thursday, the money was in CBN, and they've shipped the money to UNICEF to pay for vaccines to prevent diseases. So imagine if that wasn't done. This is verifiable, and you can, again, check all of this. So if there was no will, it would not have happened.
How did you achieve this?
I
the
think
speed, the speed, and getting all this done in less than a week.
Well, I think it's a lot of effort, but first and foremost, I think there's a leader who cares about this. I think President Tinubu cares about this issue. All his team members know that health is a priority, and so the allocations have increased. And so when there's an issue, I think I can rest, Minister of Finance can rest, but he has to do what he needs to do, and CBN didn't rest, and MPHCD didn't rest. That's why MPHCD was not in Calabar, because I asked him to stay and make sure that money goes out, and it's money that goes out to pay for the vaccines, which, by the way, all the vaccines to Nigerian children are funded by the federal government. States don't contribute into that. And it costs money, those vaccines. But to prevent measles, I heard about measles, to prevent diphtheria, 99% of children who are immunized don't get, of those who have diphtheria have not been immunized. So there is something that community members themselves can avail themselves to use those services. So from government side, the political will has never been higher, right from the president down to us that work with him, and also those that work with us. And I believe that even some of our states, they are manifesting that. Their governors are writing, I have 36 letters now in my office to all the state governors, all on these issues. So we're beginning to address the system of governance for health. But we cannot relent. And so civil society use facts. Look at the expenditure trend. Look at the releases. But more important, look at the efficiency of those spending. Everyone says we want more money, more money, more money. Well, that's probably not the only way to look at the problem. Within existing money, you can spend even better if you allocate it to the things. You can spend all the money in workshops here, but you can also spend some of this in the front ends. Recently, a group came to me and said, oh, they want to have a conference. I say, okay, how much is this going to cost? They say, oh, it's 250 million, 30 million, or whatever. I say, okay, can we do it via Zoom and then send the money to the primary healthcare centers to address the issue? They say, oh, Minister, we know we're having all people coming. Oh, I can understand people want to travel around to actually have those things. So to some extent, you'll do them. But can we have a bit less
Budget.
big lunches and a bit less, and use that to the front end? And believe you me, and Timoji, we've begun to see those shifts. 2023, I think 61% of the external funding from RMET, and this is verifiable, was in policy, planning, monitoring, and all of that. This year at the JAR, we saw that for the external resources, 91% was in the front end, going to service delivery. So even with less money, you can stretch that money and use it better. Even as we then make the case for more. Because if we're not spending the money well, my colleagues, budget or finance minister, will find it very difficult to give us more money. For the states, if you're Commissioner of Finance, the Treasury, thinks that if they give you the money, you'll just check out and go somewhere else. Mm-hmm. It's unlikely they will prioritize to give you. But if you spend what you have well, the confidence to give you more will be enhanced. And that's why the accountability piece is so vital, and that's why we're harping on it.
Yes, very important. Honorable Minister, please, I also want you to speak to renewing confidence. Because at JAR, it came out boldly that we need to renew trust. Because even if you have facilities that have been renovated and people are there to work, you have lucky to have human resources, how do you create demand? What are you saying to Nigerians using this august gathering of media practitioners? How do we engender that trust that in those days you could go to a dispensary and you're happy with what you get? Yeah. But now you'll be afraid, according to what we've gathered, to even visit the tertiary institutions.
It's a much broader issue. Trust in governance, trust in institutions, trust in science. Over time, it's atrophied. But trust, I can't come and say, Antimoji, trust me. I have to earn that trust. The question that we have is, successive administrations and states, have we earned enough of the trust of citizens. And trust is not given just freely. So when there are many failed promises that are unmet, citizens, no water. You go to my village, for instance, for a very long time, there's no road, no water. But how do you go and tell them that, oh, trust me, I'm working on your interest? So you go to Ilela in Sokoto State. There are issues that eat up the trust capital, the social capital, and the trust that people have at the communities. So there are many facets of earning that trust. So for immunization, we rebuild the trust by working with, first through trusted channels, because the community leaders, traditional leaders are in the community. When there's death, they're there. When there's birth, they're there. When there's marriage, they're there. And populations listen to them, and it changed their behavior. But when we are focusing on expanding basic healthcare service provision, delivering immunization, in many communities, that's the only thing that Nigerians are getting from government. So that encourages them to say, oh, government cares about us. So take immunization, for instance, at Moji. I went to a place in North Imboro, Kolorong. The whole place, there was nothing. There's no power, no school, no hospital. But the only thing that they have is the IPD markings, because the vaccination campaigns were. That's the only thing that goes to that remote community. So health services can be a path for establishment of trust. If a woman who is treated for emergency complications gets that reimbursed, we're winning that mind and her family and her neighbors. So they begin to respect the trust that government actually stands for them. And that is beyond just health sector. It's all of us. As professionals, we've been told, the clinical professionals, that the trust of the patient should trust the provider. So we also have to behave as professionals that care about lives and healing, reducing pain, for the population to respect us and to trust us. When professionals decide to act as if they are just, with all due respect to some other kinds of workers who can just abort work overnight and say, oh, I don't care, even if somebody is bleeding, oh, I'm on strike. That doesn't engender trust because people cannot predict. But there are certain professionals that even if there are grievances, they will have other constructive ways to engage and resolve them. So there are many facets to it. And for government, delivering on what we promise, or at least trying to deliver on what we promise, is also part of that. That's why we have matrices. Nobody asks us for KPIs. Nobody asks us to set targets for immunization or the joint annual review. In fact, the citizens didn't ask us to ask them what their priorities. We did that so they can begin to see that we are trying to meet them up in terms of their needs. And hopefully, that effort in earning their trust will be reciprocated in an environment where, for decades, trust had been eroded. And I believe that is the promise of this administration over the last 2 years, and that we're continuing to build on it.
Thank you very much, Honorable Minister. I understand your time is almost up with us, but sir, if you don't mind, I would want comments from members of participants. So I have so many hands up. Yes. I'm going to be, yes.
Yes, time is limited, but you see, you showed us a picture here that was very dire. And if it is serious enough, then we do. What I'm going to do next is actually going to Parliament to see if we can push for more resources for health, for taxation of sugar-sweetened beverages, so that we can deal with public health. So I'm assured that a few more minutes will not prevent that. And these actors here, if you follow me there and you say we need more to prevent non-communicable diseases and earmark those resources for health, that will make my job easier. So I can use.
I can assure you that there's a robust representation of the CSOs waiting for you to support what you are going to be saying and doing at that level. Okay, I'll take one woman from here and a man from here. And it's going to be random. Who is taking the microphone? Okay, let's start with the man in the Yeah, in my country, people's cap, yes. Because the men were complaining before you came that it's all about women's health. So let's start with the men. Yeah. Let's know you, please.
Good morning. Good morning, everybody. Um, Good morning, Honorable Minister. Auntie Moju, it's an honor to be here. First off, my name is Igwe Victor Eberechuku, a delegate of the National Youth Service Corps, and also a mental health advocate and a graduate of psychology. I'm with an organization, I Choose Life Foundation. We are a youth-driven organization that seeks to combat substance abuse amongst youth in the society. So in a recent survey as published by the World Health Organization and also fact-checked by Premium Times, about 20 million Nigerians currently, which is over 20% of our Nigerian population, have faced and laced with mental health challenges. So, and the disparity is even worse in rural areas and outside major cities, which means undeserved populations may have virtually no access to mental health support, as highlighted in the video we just watched. So how do we scale up the care for mental health awareness in our society? And also, how do we reintegrate post-rehab patients into the society amidst the stereotyping and segregation, sir? Thank you very much.
Thank you very much. Yes, I recognize the young. Do you have your? Yeah, the younger, young lady, really. Yes, in glasses. Yes, in glasses.
Good morning, everyone. Good morning, Honorable Minister. My name is Shismiri. I'm a student of University of Abuja. So my question is, for people now who are in the rural areas, we already know that, okay, yes, there are going to be infrastructures. What about people who don't have the money to pay for their health care? Is there any going to be a form of grant for them? And also, what about the doctors who are very negligent? Because sometimes you go to the hospital and when the doctor is meant to treat you, the doctor will be behaving rude or he or she will not now arrive in time. Is there anything that's going to be done for that? Thank you.
Thank you very much. Honorable Minister, sir.
Okay, I think I've been asked to respond to this. I'll be brief so that we can take more questions. On mental health, I agree with you. I think we've got a large burden, just as many other countries are dealing with. Many stressors, but it's an illness. And so as a society, we have to begin to show that empathy, that awareness for folks who suffer from depression, anxiety, or other psychotic illnesses to actually be attended to. From the health sector perspective, 2023, we had a new mental health policy which was put in place, which essentially tries to mainstream it, including integration within primary health care, including in the training, retraining of frontline workers. We have some challenges, not adequate psychiatrists, for instance, that requires time, but there are also things that every one of us can be able to do in terms of if you see someone, whether it's a vagrant or a relative that has depression, anxiety, or psychotic, instead of stigmatizing them, hold them close, find them the help that they need, while we're investing in the platforms for service delivery. At the end of the day, if there is no where to get the services, it becomes theoretical. They go to other places. The other issue is not necessarily within the means of my ministry, is substance abuse. That I think between NAFDAC, NDLEA, and other parts of government and PCN, trying to limit that, and particularly among our youth, is a major driver of some of those issues. So there are the organic ones, which are to be attended. There are others that are precipitated by stressors, and there are others that could be driven by substance abuse. But regardless of the driver, all of us can do better in terms of the awareness, in terms of destigmatizing, even things extreme, like suicide, for instance, which had been legalized, and to try to repeal that, to take away stigma associated with what is actually a clinical illness. On the issue of rural areas, and yes, I agree with you, affordability is a major issue. In all the People's Voices survey we did, affordability comes up tops. It's been tough for our people. We try to double down to expand the vulnerable groups, but somebody has to pay for that. Even if it's free, at point of service, somebody else has to pay. Who is that someone? That someone ought to be the public purse. That's why the allocations to health, as we go to 2026, if we get more money, we'll allocate to cover more people. But if there isn't that money, you cannot insure someone without paying the premium for it. And by getting more and expanding, by states doing that, the cost, hopefully, of access will be minimized, because health at the front end is not a money-making venture. But the health workers themselves, I think when we talked about trust, whether in the training, whether in the comportment, as a minister, what I advocate is that we should have health workers that demonstrate more empathy to be able to treat people with respect, to listen, to take our duties. Now, that is an aspiration. Various folks have different motivations for joining into the health profession, and not everyone will be good. But I truly believe that the majority of Nigerian health workforce go into the professions, nursing, medical, whatever part of medicine that they are involved with the intent to serve. And that despite the challenges, they will do their best, even if there are a few that may have a different orientation. And that is something that is out there. But our regulator, MDCN, for instance, or the National Midwifery Council, or PCN, I think we've heightened their watchfulness for malpractice among professionals. They're the regulators for setting the standards as well. There are 1,001 problems, but we're beginning to pick some of them, at least to address them as best as we can. And we'll continue to do so, and it will have to take place over several years, because the atrophy didn't happen just overnight.
Thank you very much. Yes. Within the context of the theme, which is evidence, innovation, and financing for a healthier Nigeria, I think the coordinating Honorable Minister has done justice. If you agree with me, show by yes. If you don't agree, then we'll have to talk to Premier Times so that we can situate this dialogue again. But as we allow him to go to pursue, yes, Nika, you're not, you're not with me, but we have to allow him to go. I think that it's important for us, particularly as media practitioners, to have a cluster of somebody. Right? Do I take one and last, and make it short? One and last. I'm sorry.
Okay.
Okay.
Okay, I think I win, so I should actually say thank you. Thank you, Ma'am. Honorable Minister, thank you, sir. My name is Vivian Daniel. I represent Sondiata Post and Iron Media. Sondiata Post is owned by Dr. Mas Amuche. All right, so I'd like to ask, sir, Honorable Minister, a promise said is a promise kept. You have said a whole lot, and yes, we believe that the government is doing also a whole lot to revamp the health sector. So today, sir, we would like you to give us your promise, on behalf of the federal government. By this time next year, where should our PHC, where should it be? And then in terms of allocation, in terms of budgetary allocation, in 2026, what are we expecting? Thank you, sir.
Thank you.
Yes. No, I'll give you one or two, but you and all the journalists that are here will also give me a promise. Do we agree? Do you agree? All the journalists here will give me 2 promises. 3. So, okay. So I think we had more than 8,000 primary healthcare centers receiving BHCPF resources. For BHCPF 2.0, we've stretched ourselves to add 5,000 more. I believe by next year, we will be far along in that target to get 5,000 additional receiving BHCPF if all goes well in terms of the resourcing, the flow of funds, and that it could be verified. I don't control the purse, but the aspiration, we have made it. 2, in terms of federal allocation for health, it's in the hands of other sectors beyond me. It's also in the hands of the National Assembly, where I'm heading right now. My hope and prayer is that we will get closer, more closer to 6% than away from 6%, which will be the highest ever federal allocation in health. That I will do, yes, in terms of percentage of federal budget, because it was 3.4, literally less than 4, and we've moved it up. It's not enough, but we are working, and I know the president is intentional to increase that. We will advocate with the legislature, with our budget colleagues. This morning I did some of that work. We are now going to see in the Finance Committee how the excise can also be increased and earmarked for public health. That's where I'm heading immediately, Alifia. So I do think when we meet next year, I will say that the allocation is closer to 6 than away from it, than closer to 5. That's my promise. Now, on your side, what are you promising me? Your voice matters in achieving this as well. Your voice matters. And so raising your voice, coming out clearly, not only for federal but also state governors, look at where they are and point to them to also increase and to support this direction. If you can just use that, that's a good trade. 2 for 1. I gave you 2, you give me 1.
Thank you so very much. One thing I can assure, I'm sorry we don't have that time, but I'm sure that he has a very vibrant media section that we can continue with this. Maybe, you know, by monthly or something, we'll have to come up with something so that we can engage with him, because health investment is an imperative for development.
Yes, and Moji,
yes,
please, there are others. So even if you can't get me, my colleague, the Minister of State, is there, the SWAP Coordination Office is there, NHIA is there, MPHCDA is there, PVAC is there, NACA is there, NAVDAC is there. They are authoritative in their own ways, and they are close to some of these peculiar issues. I sit there, maybe I'm the talking head, but you can also ask them. But beyond that, each state governor you see, whether on the road or commissioners that you ask them the way you are also asking me what's happening in their states. Sorry, commissioners, I'm putting you in trouble. But I think we've been talking among ourselves. So it's a conversation. There is no, let's say, one solution. It's a conversation. And it is us, it's part of building that consensus. And if there are mistakes, we correct them. If there are things that we can do better, then we do them. But if we don't talk among ourselves, nothing happens. Thank you very much.
Thank you.